A very good evening to all of you. Today we are going to do the MCQ challenge of Neet PG live neurology, that is medicine, nervous system. So medicine, the system is nervous system. See, a great chunk of MCQs come with from this section of medicine. So let us begin with the first question. Term hyperpathia includes which of the following? A. Hyperesthesia. B. Allodynia. C. Hyperalgesia. D. All of the above. What do you think is the correct answer? Please comment in the chat box. Term hyperpathia includes which of the following? A. Hyperesthesia. B. Allodynia. C. Hyperalgesia. D. All of the above. See, this hyperpathia encompasses all phenomena: hyperesthesia, allodynia, hyperalgesia. So the correct answer here is D, all of them. Now let us move to the next question. In Dejerin-Roussy syndrome, don't get confused with the name. The name may be big, but it is just. Let's see. The lesion is in A. Spinal cord, B. Brainstem, C. Thalamus, D. Cortex. Now, what happens in thalamic syndrome, which is also called Dejerin-Roussy syndrome or Joseph-Julie Desiree and gustative Roussy? It is a thalamic pain syndrome. It is a thalamic pain stream syndrome. It is a post-stroke central pain syndrome. So the correct answer here is thalamus. The lesions affecting the thalamic ventroposterolateral nucleus or adjacent white matter produces a syndrome of persistent, unrelenting unilateral thalamic pain. Persistent, unrelenting unilateral thalamic pain, which is called Dejerin-Roussy syndrome. So the correct answer here is C. Thalamus. What is the prevalence of epilepsy? A. 2 to 6 persons per thousand. B. 3 to 9 persons per thousand. C. 4 to 20 persons per thousand. D. 5 to 30 persons per thousand. Well, this epilepsy is a very important topic. But one thing I want to tell you is that some of the statistical figures, if you are able to remember them properly, you can solve some of the difficult MCQs which most other peoples will not be able to solve. So the correct answer here is D, 5 to 30 persons per thousand. Non-motor manifestation of focal seizures can be A, sensory, B, autonomic, C, emotional, D, all of them. See, these focal seizures have motor manifestation, tonic, clonic, or myoclonic movements, or non-motor manifestation, sensory, autonomic, or emotional symptoms. So the correct answer here is D, all of them. Which of the following gene for various epilepsy syndrome is associated with severe mental retardation? A. CHRNA4, B. KCNQ2, C. SCN1B, D. Double cortin. See, this double cortin expressed primarily in the frontal lobes. It directly regulates the microtubule polymerization and building. It is X-linked dominant. Classic lesioncephaly is associated with severe mental retardation and seizures in males, and subcortical band hypertropia with more subtle findings in females. So the correct answer here is D, double cortin. Gene associated with Unwer-Rich-Lundberg disease is A. CSTB, DEPDC5, C. EPM2A, D. LGI1. It is CSTB. Which of the following statement about Lennox-Gastaut syndrome is true? A. Multiple seizures type. B. EEG shows slow, less than 3 Hz spike and wave discharge. C. Impaired cognitive function. D. All of the above. It is all of the above. The triad of Lennox-Gastaut syndrome includes multiple seizures types, slow, that is less than 3 Hz spike and wave discharge on EEG, and impaired cognitive function. Characteristic of Landau-Kleffner syndrome include A. Auditory agnosia or word deafness, B. Normal hearing, C. Abnormal electrical brain activity, D. All of the above. A childhood disorder in LKS, there occurs gradual or sudden loss of ability to understand and use spoken language. All children with LKS, that is Landau-Kleffner syndrome, have abnormal EEG and may have epileptic seizure, usually at night. Hearing tests show the normal hearing. So the correct answer here is D, all of the above. Gun barrel vision is best related to A. Anton syndrome, B. Balint syndrome, C. Claudius syndrome, D. Waldenus syndrome. In Anton syndrome, rarely only peripheral vision is lost and central vision is spared, resulting in gun barrel vision. So the correct answer here is A. Anton syndrome. Now, CADASIL is due to mutation of which gene? A notch 1, B notch 2, C notch 3, and D notch 4. See, CADASIL is caused by mutation in notch 3 gene. This notch 3 is a member of highly conserved gene family characterized by epidermal growth factor repeats in its extracellular domain. Stroke due to monogenic disorders represent less than 1% of all stroke patients. They are cerebral autosomal dominant arteriopathy with subcortical infarcts. And so this is CADASIL means cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy. CADASIL. Cerebral autosomal recessive arteriosclerosis with subcortical infarct and leukoencephalopathy is called CARASIL. Hereditary endotheliopathy with retinopathy, nephropathy, and stroke is called HERNS. Hereditary endotheliopathy with retinopathy, nephropathy, and stroke, HERNS. So the correct answer is C, March 3. Pentobarb coma refers to A. Coma due to accidental ingestion of barbiturate. B. Coma due to barbiturate given for induction of anesthesia. C. High dose barbiturate for refractory elevated ICP. D. Any of the above. It is high dose barbiturate for refractory elevated ICP. Polycystic lipomembranous osteodysplasia with sclerosing leukoencephalopathy is called A. Nasu-Hakola disease, B. Motohasi-Shinohara disease, C. Akai-Tatesi disease, D. Nakamagi-Shioi disease. C. PLOSL or Nasu-Hakola disease is an autosomal recessive disease due to mutation of TYRO-BP and TREM2 that are expressed in microglia and osteoclast. There occurs delayed differentiation of osteoclast and microgliosis, resulting in imbalance of bone remodeling capability, leading to bone cyst formation. Inflammatory and immunological imbalance in brain results in brain atrophy and dementia. It is known as Nasu-Hakola disease. Which of the following procedure is used for correction of TGA? A. Mustard procedure. B. Senning procedure. C. Rastelli procedure. D. All of the above. All of them. Taranfurbil and semaglutide are A. Estrogen analogs, B. Vaccines, C. Gamma secretase inhibitors, HMG corerectase inhibitors. Well, they are gamma secretase inhibitors. Dementia pugilistica is related to which of the following? A. Non-convulsive seizure disorder, B. Transient global amnesia, C. Chronic metal exposure, D. The recurrent head trauma in professional boxers. See, this recurrent head trauma in professional boxers may lead to dementia, which is called punch drunk syndrome or dementia pugilistica. So the correct answer is D. Familial Parkinson disease is associated with mutation in which of the following genes? A. Pink1, B. DJ1, C. Parkin, D. All of the it is all of them. Please click the link in the description box to join the ultimate Neet PG Breakthrough Blueprint event. Well, it it is covers all the 19 subject in a holistic manner in just 2 days. That is almost 3 hours daily for 2 days, and it will facilitate your revision and take you to the next level, so that you know what to study and what not to study, and what to revise and what not to revise. See, revision is the key to success. The more you revision the right amount of study material. See, people buy a lot of study material, which is not at all required. You have to study the same study material again and again to score good marks in NEET PG. So let's go to the next. Which of the following about Kufer-Rakov syndrome is false? A. Autosomal recessive form of juvenile onset (PD) caused by ATP13A2 gene mutation. C. Supranuclear upgauge paralysis. D. None. So the correct answer here is D. None. Kufer-Rakab syndrome is a rare autosomal recessive form of nigrostriatal pallidopyramidal neurodegeneration caused by ATP13A2 gene mutation, presenting as juvenile onset Parkinson disease. Rapidly progressive symptoms of Parkinsonism, spasticity, supranuclear upgauge paralysis, facial, facial, finger mini myoclonus, visual hallucination, oculogyric dystonic spasms, and dementia, usually noted between 12 to 16 years and leads to severe motor handicap. The only oral agent that reduces dyskinesia while improving Parkinson feature is A. Selegiline, B. Amantadine, C. Bromocriptine, D. Pegolide. It is amantadine. Please click the link in the description box to join the 2-day ultimate NEET PG event. The first 10 people who click the link in the description box and join the group early. Please stay in the group till you clear your NEET PG exam with flying covers and get a seat in charge, because most of the things will be taught in the group free of cost. So let's move to the next question. Swollen axons of Purkinje cells are called A. Missiles, B. Torpedoes, C. Gun barrels, D. Cannons. They are called as torpedoes. Swollen axon of Purkinje cells is pathological studies of torpedoes. Which of the following is a gene for isolated dystonia? A. TOR1A, B. TOP1, C. ANO3, D. All of the above. It is all of the above. I thank you for patience listening. Please comment in the comment box what topics you want MCQs on, and please click the link in the description box to join. And there, I wish you all the very best in your examination. Thank you.